Many states across the country have created bans and restrictions to try and stop people from getting abortions. But new numbers from a reproductive health advocacy group say that abortion numbers continue to rise. 12 News reporter Kel Chapman spoke with a Wichita clinic about why they're seeing more patients.
The clinic says in 2023 they saw over 4,000 patients, with around 80% of them coming from out of state. And Trust Women Communication Director Zach Gingrich-Gaylord says numbers aren't slowing down.
As long as these other states are continuing to either severely restrict or just ban completely abortion, we're going to see the continued, forced travel of people who need this type of health care.
A new report by the Guttmacher Institute says that in 2023, Kansas saw an increase in provided abortions of more than 9,000 compared to 2020. And 71% of abortions provided in Kansas during 2023 were provided to out-of-state patients.
We knew Kansas would become a destination for abortion.
Kansas for Life Director of Government Relations Gene Godun says a potential new law could help lawmakers learn what issues motivate patients to seek out an abortion. If enacted, the law would require medical care providers to report the reason patients are seeking an abortion to the Secretary of Health and Environment.
This information can give policymakers what they need to be able to address some of the situations that are happening in a number of different areas.
But Gingrich-Gaylord says asking these questions in a clinical setting is inappropriate.
The way this bill is there's no oversight, there's no participation by legitimate research organization. It's not necessarily the act of collecting data, but it's the manner.
In Wichita, Kel Chapman, 12 News.
Also shows that medication abortions made up 63% of all U.S. abortions. He says that he expects KDHE's 2023 abortion numbers to come out later on this spring.